Okay, welcome back to our to the weekend show, and this is the lifestyle segment. I am Edidion Frank, and as I said earlier, we'll be having a discussion on the concept of autism and inclusion and creating a supportive environment for early learners. Today, joining us for this discussion, we have Olajumoke Helen Jokodola, who is a special needs educator. Good morning.
Good morning. Glad to
Thank
be here.
you so much for
Thank you.
joining us on the show today.
Thank you very much.
So, let's talk autism. Can you brief us on what autism means?
Okay. So autism is a neurodevelopmental disorder that affects four major areas of the child's life. We could talk about the social interaction, the communication aspect, the learning aspect, and also behavioral aspect. So for social interaction, you have children, you have a group of children who are playing, and then you see this child is isolated. The child does not want to share toys. Children are on the playground. The child just wants to be alone. So that is the aspect of the social interaction. We have communication, the language aspect. You could see delay speech. The child, normally a child at 1 should start babbling, tada, mama, and all of that. But that child at that age is not producing sound. At 2 years, the child is still there, not producing the sound appropriate for that age. That is delayed speech. For behavior, we see children throwing tantrums, crying, yelling. You want something and then you are not getting it. And then the best way to express your emotions is to yell, cry, throw things, self-injurious behavior, hit your head on the wall, throw yourself down. So those are the aspects we look out for, and then you know there is a problem or there is a challenge.
What age group do you deal with?
Okay, from 3 to 15.
Okay,
Yeah.
that's a large
Yeah.
age group. You know, when I see special needs educators, I see you all as angels, to be very honest. I come from a school family,
Okay.
and because lots of my family members are into education, and I've been privy to sit in a classroom where they're teaching the special needs classroom, and the patience that goes into it. I just have to give
Yeah.
you and all special needs educators
Thank
around the
you.
world your flowers, because it takes a lot of patience, a lot of sacrifice,
Yeah.
and I feel it's something you do out of, you know, the kindness of your heart, not just because you're a teacher.
Yeah.
So kudos to you
Thank
and
you.
everyone. So how important is early diagnosis?
Okay, so if you find out the problem on time, you're able to get help immediately. So because it's easy to mend when the child is still young, and when the child is already grown, the behaviors have set in, the challenges are in there. So trying to get that child out of that space would be very difficult. But early intervention is very, very important. You diagnose on time, you get the right help on time, you get the right therapist on time, the child goes through the therapy session early enough. It helps the child become independent. Yes, the child may not outgrow it, but it helps the child be functional, live independent life, able to cater for himself or herself. So it's important that early intervention is key.
Is autism something that can be treated?
No,
Oh, really?
there's no known cause for autism, so there is no cure. So what we do is we just help the child live independent life, help the child with daily skills, okay, how to take care of yourself, how to interact with your peers. Yes, it may not be easy because we know they are unique.
Yes.
The way they reason is different. What a neurotypical 5-year-old child would do at ease or with ease, that child will struggle. But when therapy sets in, it helps the child. Yes, I may not function as my age grade, I may not function the way my age mates are functioning, but I'm functioning at my own pace, and then I'm moving on. So
What are
therapy is
some
important.
okay? What are some common misconceptions that you've
Okay.
encountered around autism?
Okay, tell you, okay, probably it's a spiritual problem. 'Cause
Particularly in this part of the world.
exactly,
Yeah.
in this part of the world, or probably there's something wrong. We take the child, instead of seeking help, you are taking the child from one place to another, or this thing must be out, locking up the child because you don't want people to see that child, or you don't want people to know that, oh, I gave birth to a child who has a problem. So those are misconceptions. Oh, if I take this child to this social gathering, the child will embarrass me. Every other child is seated, very calm, but my own child is all over the place. I don't want that. So there's this isolation that sets in from parents. I don't want anybody to know.
How do you deal with children that, are going through that?
Love. That's the first thing. And then patience. If you are not patient, I bet you can't do it. Because there are times I've gotten to this point that I'm not doing again. What am I looking for here? But when it's coming out of a place of passion, then that's where the love sets in. You are patient, you are tolerant, and you know that these children don't know what they are going through. They don't know how they act. They don't know why they do what they do. So it comes from that place of love and passion.
So how can parents and schools also, academic institutions support an inclusive learning environment? Because it's not popular.
Yeah.
Yeah, it's very expensive when you eventually find a school that caters to, special needs students. How can we make this a norm in order to include and support their learning?
So the first thing I'll say again is love. If as a community, you find out a family are dealing with a child on the spectrum, it's important that you show love. Yes, you may not have the finances to support them, you may not have what it takes to support them and all of that, but it's important that the first thing you can give to them is love and encouragement. For our schools, provide conducive learning space for them. Yes, we know some schools tell you, oh, we're not an inclusive school, we just want to teach the neurotypical children and go, or maybe other parents cannot afford to have their children in the same space. I've had parents who say, oh no, when a special child is here, I notice my child is already imitating what that child is doing. That is not inclusion. But when we accept that, okay, irrespective of the uniqueness, irrespective of the special differences, we are willing. And then even informing your children, there's no age grid that you can't tell the child. Yes, you may not be able to tell the child autism or someone has autism and the child will understand. There are concepts, there are languages you can bring down to that child's level. Oh, this person is unique. This person is acting different or would act different from the way you act. This person may not be able to dress him or herself up. This person may not be able to feed herself. But it's important that we show love. So if parents can also try to talk to their children that we're all created differently, we're all created uniquely, it will help. In our worship centers, creating right conducive, because for example, in the church setting, we have children's departments, and then it's just for the neurotypical children, we come forgetting that we also have special children, and then the parents have to deal with, oh, do I need to go to church today? If I go to church, will my child be able to cope? He'll be a distraction to other children. But even in our worship centers, if we can create that conducive environment of bring your child, we'll create a special class for that child. It's also part of inclusion.
Okay, can you share examples now of effective teaching practices that you do with special needs children? It could help parents and even teachers out there.
Okay, so we teach daily life skills like simple as brushing your teeth, because you've had 15-year-old children who are still struggling to brush their teeth. These are basic things that at least the child should be able to know, okay, after using the restroom, you should be able to clean up yourself, you should be able to take your bath, you should be able to dress up. So these are daily life skills. And then when we come to the educational aspects, we have different educational, which is called IEP. We have the IEP program, that's individualized educational program, that helps. So you're working at this child's pace, not like the regular curriculum. Or if you are 5, you should be in grade 1, you should know the 2 times table, you should know this, you should know that. No. So this program helps us to know, okay, this is where this child is. That is after assessment has been carried out. This is where this child is at this time. This is what this child should know. And then we're not hurrying the child. No. Let's just go at the child's pace so that at least the child can grasp this concept before we move to the next concept.
What made you decide to go into this? Because I know it's different from the normal teaching route. Yeah. What, apart from your love and passion, which you've constantly mentioned? Okay,
so I never wanted to study special. I studied special education from University of Jos.
Okay.
That was not what I wanted. I wanted to study pharmacy. and then admission list came out, and then special education. And yes, I've seen children with special needs around, but it never occurred to me I could go to school to study that. And then the aim was, okay, so I don't sit at home. I could go start. When JAM form comes out the next year, I'll go and write JAM again and apply again. But when I started, I realized, okay, I can do this. This is what I want to do. I can do it. And then I started.
So now how can our community, you know, foster inclusion? It's one thing for the school to play their part, the parents to play their part, but at the end of the day, they only spend, you know, a little amount of time in school. So the community also, you know, has to play their part. How can we, as a community, as a society, be inclusive when it comes to special needs children?
So inclusion is a mindset. If I decide, oh, I don't want to, I won't. But it's important that awareness is very important. You don't have to have a child or a family member with autism before you know what autism is. So we've had, sometimes we've got to create awareness in the mall, and then you meet people, you give them, and said, yes, I don't have anybody around me who is autistic, but I know what autism is. So now imagine that person, if someone around has it, he knows the right approach to take, they know the right thing to do. So it's important that, yes, you may not wish to have these kids, but it's important that you know. No knowledge is wasted. So that even when you come across these children anywhere, in your worship space, in the market, you know the right thing to do, or you know how to relate with them. So when the child is jumping all over the place, you are not thinking it's bad parenting. Because when we go for social gatherings and the child is just all over the place, if we just think, oh, the child is not well cultured, the child is not well mannered, the parents are over pampering this child. But when we know that, okay, something might be wrong, we can tolerate them, indulge them. And then, or we've had cases where parents will say, oh, we went to worship center and then I gave my child, my autistic child, my phone so that he'll be calm. And then you have people saying, you are spoiling this child. Why the child is, but you don't know what that parent is going through. So putting ourselves in other people's shoes, empathy, is very important. That, okay, every child will not be the same. Every individual will not be the same. And then showing love, care, support. Oh, you can just reach out, call. Oh, how are you doing? How is your child? That call alone makes the parents feel, okay, I'm not alone in this struggle. I have people around who care about my child and I.
Interesting you mentioned the phone example, because I've always thought that, you know, giving young children phones overstimulates their brains. I want to hear your thoughts on that. Is that right? Like, that's, you know, way of thinking, is that right? Or is there, you know, another way?
There should be a balance.
Okay.
Because, yes, sometimes you're out, like I mentioned earlier, the child, you don't want the child running all over the place, and you feel, I can just give you this one for 10 minutes till we're done here, so you can be calm. There's nothing wrong. So there should be a control, there should be a balance. Probably when you get home, there are other things you could do to engage this child so as to distract the child from whatsoever it is, the sensory issues the child is going on. But when you're outside, or you know, and then when the child is with the phone, necessarily doesn't mean the child is watching cartoon. There are games that these children can play. There are educational materials online that these children can be engaged on. So it's not necessarily the child is with phone just because I want to play or anything. So there are educational things the child can be engaged with online.
Is there a way to detect this before the first year, or you have to, or parents have to wait till the child turns 1 and start, you know, doing what children their age are supposed to be doing? Okay.
So it's diagnosed at 3. That is when you can now say, okay, there is a problem. Because we know that there are children who have delayed speech. There are children who 2 years they've not said anything, and then 4 years
they're talking all over the place.
Exactly. I have a friend who, her child at 2 was not saying anything, and then she was concerned. But now, the child, and then she's not, can you keep quiet? So yes, we have children who have delayed speech. That is fine. So that's why at 3, can now, okay, are there signs, are there symptoms we should look out for? Some signs of autism: flapping of hands. We call it repetitive behaviors. The child is just there and then flapping his or her hands, rocking back and forth, tiptoeing, and then you can see the child will just line up toys on a straight line. And when you go to just move it, there will be a problem. So there are signs we look out for. Tantrums, like I said earlier, the child wants something, the child is not getting it, and then the child starts. Self-injurious behavior. I cannot just sit now and then start hitting my head on the wall because it's painful. I cannot just stand up and then throw myself down. That is painful. But children on the spectrum would do that because they are not getting what they want. So,
okay, I like those examples you gave. I would like to know, is OCD part of that?
Yes.
Okay.
Because there are different factors that will contribute to diagnosing that, okay, there's a problem. And then after the diagnosis, assessment is taken. Okay, where is this child now? Can this child identify 1 to 5? Okay, no, okay, we're starting from the scratch. Can this child do this? Okay, yes, then we can go on from there.
All right. So before we go, what advice do you have for parents, caregivers, teachers, the society at large, you know, in creating more awareness and in ensuring and giving support basically to these children?
So for parents, I'll say you're doing a good job. It's not easy. I don't get to spend the whole day with these children. I just spend little time and then these children go back home. And then I know what I have to face when I'm with these children. So parents, you're doing a great job. God is your strength. So, and then for members of the society, like I said earlier, the main thing we can do is show love. And then be aware. You don't have to have a child with autism before you know what it is. So, because when we know better, we would always do better.
Thank you so much, Olajumoke, for your insight, you know, giving us more insight into the concept of autism. And to our viewers out there, it's very important to create awareness on situations, on issues like this, and to, as a community, create an inclusive and supportive environment for parents, caregivers, teachers, and everyone. That's it for the lifestyle segment. We have the breakfast segment coming up pretty soon, and so much more on the weekend show. Do stay with us.